AM Extra, watching out for your health. The first step in taking care of your health and wellness is getting health insurance.
There is still time to get coverage, but the deadline is this coming Sunday. Joining us live with more is Senior Policy Advisor at the Robert Wood Foundation, Dr. Kathy Hempstead. Good morning.
Good morning. Thanks for having me on.
Yeah, thanks for being here. An important topic here. Talk about the importance of getting coverage, and is coverage required?
Well, certainly I would say big picture, the case for coverage is very strong. If you accept that everyone deserves an opportunity to be as healthy as they can, in this society, health insurance is necessary due to the cost of healthcare. By being covered, people are able to take care of problems, respond to symptoms they have, get preventive care they might need, and manage chronic conditions, do all the kinds of things that we need to do to stay healthy. It's also a really important source of financial protection.
Yeah, I mean, we've certainly seen people getting sick so frequently right now. We've been reporting on this triple-demic of COVID, flu, and RSV. And at the same time, the pandemic has really kind of changed the landscape of healthcare over the last couple of years. How has it affected the insurance system?
I think that's a great question. I mean, the pandemic, of course, I certainly hope was a kind of, uniquely catastrophic and tragic event. And there are a lot of things we can learn from our response to it. But I think from a coverage perspective, there are some really easy lessons that have made people value health insurance more. And one of them is that good health at the population level is essential, and our society can't really function when people aren't healthy. And we certainly saw that. Another thing is that our health is interconnected, and we should care about our neighbors' ability to be healthy as well as our own, because certainly we saw that other people's health affects our health, especially in the context of an infectious disease. And finally, we saw that not everybody has equal access to healthcare and to the ability to keep themselves healthy. And we saw that very tragically in the case of frontline workers during the pandemic who were exposed to illness but didn't have the resources to take care of themselves. And we saw the consequences of that. And I think one response is that I think a lot of people think health insurance, they're taking it more seriously than they did before. And the government's also made some responses to make insurance more affordable. And that's why this opportunity with the ACA marketplace plans is such a great one.
Are you required to get health insurance? Is it a federal mandate?
It is not a federal mandate, but there are very few people that don't want to be covered. And those that aren't covered and say they don't want to be covered, the main reason they give is that they think coverage costs too much. I mean, that's the major barrier between people and coverage is cost. And so I think it's really important that your listeners and viewers understand that the plans in the Affordable Care Act's health insurance marketplace are much more affordable than they were even a few years ago. So if people looked a few years ago and thought, gee, I didn't qualify for a tax credit, or these plans are too expensive, I'm not getting enough of a tax credit, they're far more affordable now. And in fact, 4 out of 5 enrollees are getting a plan that costs them $10 a month or less in premiums. So it's a really, really important opportunity for people that don't get coverage through a job and aren't eligible for Medicaid or Medicare.
Wow, and could be a really important investment if you're, unfortunately find yourself getting sick this year. Now, just to clarify, in case anyone's wondering, why are we talking about this? I thought we talked about health insurance signups at the end of the year. Those deadlines have passed to have your coverage start January 1st of 2023, but we are coming up on really the last deadline of the year to be able to have coverage start in February. So how can people sign up right now, and how is the Robert Wood Johnson Foundation helping with that?
Well, Oregon has a state website that kind of uses the federal enrollment platform. So there's a place called Oregon healthcare.gov that people can go to, or if you don't remember that, just go to healthcare.gov. That's the federal enrollment website, and there people can find all of the information that they need, and they could get help on the phone, or they can get help online, they can get help in different languages, and they will get routed to the state website where they can see what plans they can choose from.
Thank you very much. Appreciate your time. Good information here, Dr. Hempstead. We appreciate you joining us on AM Extra.
Thank you very much for having me. Appreciate the opportunity.
And for more on enrollment options, we do have links and resources posted on the AM Extra section of coin.com.